Madison Weatherly, and this is my audience. Matthew Ezrioa wrote, about 1.5 million people in the United States have rheumatoid arthritis. Rheumatoid arthritis affects many families and individuals. I had an interest in finding out more about this disorder because it has affected my family personally. I began research to better understand this arthritis and what it all entails. I have read many different articles on a variety of different websites. In my speech, I will first talk about causes and effects. Second, I will discuss the symptoms, and finally, I will elaborate on treatment options. So let's take a look at some causes and effects. According to the American College of Rheumatology, rheumatoid arthritis is a chronic, progressive, inflammatory disease affecting primarily the small joints of hands, feet, wrists, and ankles in a symmetric fashion. Doctors are not sure what causes the immune system to attack its own tissues, but they have identified some contributing factors such as genetic factors, environmental factors, and personal factors. The genes play a small role in the body for this disease. Researchers have found that HLA can increase the disease by 5 times. However, if you have HLA, it does not mean that you will get the disease. Environmental factors such as bacteria and viruses, exposure to secondhand smoke, air pollution, insecticides can all increase your chance of getting this disease and you need to look out for. Personal factors include age, sex, and family history. Both men and women are susceptible to this disease. However, according to Matthew Ezrioa, 70% of people diagnosed with rheumatoid arthritis are women. The disease can be present at any age, but if you fall between the ages of 40 and 60, you're more susceptible to rheumatoid arthritis. Family history is not a determining factor, but it will increase your chances for the disease. These causes and effects can be discovered through your symptoms. Rheumatoid arthritis is a very common disease with a fair amount of causes and symptoms to be aware of. It is of utmost importance that you watch for these symptoms. Some of the most common symptoms are joint swelling, fatigue, and joint pain. Active rheumatoid arthritis can cause the joints to swell, thickening the lining tissue and excess joint fluids. The swollen, inflamed joint stretches and irritates the capsules that surround the joint. Capsules have nerve endings that send joints that send pain immediately to the brain. Shield Jr. stated, fatigue in rheumatoid arthritis can be caused by the body's reaction to inflammation, poor sleep, anemia, and medications. Fatigue is common throughout all stages of rheumatoid arthritis and have effect on your relationship because you are so worn out and emotionally drained. In order to manage the lack of energy, it is crucial to have nutritious meals and maintain a healthy weight. Thus, joint pain can occur for the rest of your life depending on how intense the swelling of one's joints are. Though these symptoms can be very painful, there are different options to help manage these. To help with these symptoms, doctors have come up with different treatment options. The optimal way to treat rheumatoid arthritis is an early aggressive treatment. The goals of treatment of rheumatoid arthritis include stop inflammation, relieve symptoms, and improve physical functions. Inflammation can be controlled with different medications that can be bought over the counter or prescribed by a doctor, such things as NSAIDs, for example, Aleve and Advil, or corticosteroids and DMARDs. However, with these medications come side effects like liver damage, high blood sugar, and leg swelling. Matthew Ezrioa wrote, keeping an active, healthy lifestyle is just as important as treating RA symptoms as the right combination of medications. For some people, exercise can be so painful and irritating on the joints, so attending physical therapy can help them do this. It makes it easier to reduce it. Centers for Disease Control and Prevention stated, experts recommend the ideal adult to be moderately physically active for 150 minutes per week. So by attending therapy, victims are able to improve their physical function and be stronger every day. To figure out what treatment is best for a patient, they need to sit down with a doctor and go over their symptoms and treatment options. RA is an autoimmune disease in the immune system. Today, I first talked about the causes and effects, then the symptoms and treatments. An anonymous victim stated, every day is a fight, every morning is a battle to get ready for the day. Every afternoon is a fight to stay awake, every night is a fight to find sleep. And between every fight is another one fighting pain. Constant pain all day, all night, every single day. The pain hasn't stopped me, but it hasn't stopped. I am a chronic pain warrior. Thank you, and this is my audience.